Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCD of the patient that you had requested. The area of interest is the upper right canine and the upper right anterior region. The upper right canine is impacted. It is placed buccally, as you can see on the 3D rendering. On the panoramic view, which is a segmental panoramic, we can see that the upper right canine is in close approximation to the roots of the central incisor and the lateral incisor, and the apex of the canine is in close approximation um, to the roots of the premolar. We will just let you know which premolar it is in a bit. Now, the transaxial view, or basically the proximal view, is where we will start. So this is the central incisor. This is the incisor foramen. As you move distally, you will be able to appreciate that we can actually see the cusp tip of the canine. This cusp tip is perforating the buccal cortical plate, which is why we can see it on the 3D rendering as well. Now, this is the lateral incisor. The lateral incisor, the canine cusp is placed buccal to the lateral incisor, and the roots of the lateral incisor have been pushed palatally. You can see that there is no radiolucency or root resorption in this case. As we are moving further distally, we see that there is a radio-opaque material right here. We cannot identify as to what this radio-opaque material is, but we can suspect it is adhesive material from a previous attachment on the canine. Moving to the more distal aspect, you can see that the adhesive material has a little bit of a radiolucency around it. We've got thin bone, cortical bone or soft tissue over the buccal aspect of the canine. As we move further towards the apex, you can see that the middle to apical 1/3 of this canine is embedded firmly in the bone and has cortical bone coverage on buccal as well as the nasal as well as the parietal aspect of this tooth. We move further and then we can see that the premolar appears. This premolar appears to be the second premolar, as it has a singular root. We've got a 2-1-2 canal configuration here as well, which is quite visible in this area as well. So there we go. We can show you the 2-1-2 configuration, which is right here. So 2, 1, and then later 2. So this is if there's an endodontic need of this tooth, but this is where the apex of our canine is right here. So if we will show you the axial view, which is basically the top to bottom view. On the axial view, it is very clearly visible that the canine cusp has perforated the cortical plate, and here you can see it is lying comfortably inside below the nasal floor and inside the maxilla. So if there are any further questions regarding this case, we would be extremely happy to help. This is another view. This is an axial view, but we've actually shifted the axial view for our doctor to see the canine in its full length, and that's here where you can see the canine. We've got a little bit of a radiolucency on the palatal aspect of the nasal aspect, and we've got perforation here. So if you have any further questions, please feel free to reach to our team. Thank you very much. This is the sagittal view. As you can see, the sagittal view is quite visible here, and we've got the second premolar, and we've got the central and the lateral incisors right here. Thank you very much.